Good morning, everyone. Today we will discuss a very relevant questions which the cancer patients or their attendant often ask. Do my cancer will run in family? Does cancers run in family, especially when the patient is being cured and he or she has chances of getting married, or if the patient has cancer and he or she has a daughter who are going to be married, they are often anxiously asked that do my cancer will run in family. No, it's not. Rarely, there are rare situations where the cancer can run in family. Otherwise, cancer is not a genetic disease, it's not a hereditary disease on and large. There are some hereditary genetic mutations like BRCA1, BRCA2, other some mutations which come under the HRR gene panel that can sometimes leads to hereditary breast, ovarian, pancreatic, prostate, or some rare cancers. Most of these are hereditary breast and ovarian cancer. But overall, if I take all the breast or ovarian cancer, then hardly there are 5 to 8% that can run into families. So it's not necessary to get the hereditary panel test done in all the children. There is a proper methodology. If your doctor suspects, then once you are have started your treatment, then in a timeline it can be tested after proper counseling, with a counseling that if it comes positive, then there are some treatment modifications that we might use in your case once the hereditary gene comes positive. And also at the same time, your children needs to be tested after a certain age, maybe after 35 years, 40 years, once they have completed their families, or in some cases earlier also, and also your other siblings. So on and large, it's not to be afraid that cancer is a hereditary or familial disease. And even if someone has a hereditary genetic mutations, and later on if a patient has this mutation and later on it is found that his or her children or siblings also have these mutations and they are healthy right now, it doesn't mean that they will develop cancer 100% if they maintain a healthy lifestyle. See, there is a mutation, but that mutations on its own doesn't always bring cancer to occur, cancer to evolve. There are lots of epigenetic mechanism which we do in our life, in our day to day lifestyle modifications, like healthy lifestyle modifications, which I have already mentioned in my lots of videos, like physical exercise, healthy diets with lots of green vegetables with colored fruits, and healthy lifestyle with less and less of stress, physical activity more and more of, can do epigenetic modifications that can dramatically decrease the incidence of cancer in a particular normal individual who have this genetic mutation. Got my point? Epigenetic changes, just as if you get a normal CD or CD player and you keep on running it, then after a few years scratches starts appearing. Similarly, if we clean that CD player and properly we insert it, properly we ejaculate, properly we take it out, then the chances of getting scratches on that CD player will be less, and that scratches will come after long duration, long span of time. Similarly, if we bring a lots of healthy changes in the lifestyle of that particular healthy individual, the son and daughter who is having a particular genetic mutation that is prone to cancer, then on the back of this healthy lifestyle can counteract those genetic mutation, and those genetic mutation can surpass after the age of 65, 70, 80 years to cancer to occur if it has to occur. So there are still chances that in spite of having a genetic mutation, hereditary mutation, a healthy individual can dramatically decrease the chances of getting cancer in his lifestyle by decreasing the epigenetic, harmful epigenetic mutations that supplements to the hereditary mutation. Each day as passes, each our birthday, we keep on compounding lots of epigenetic mutations, modifications in our genome that augments the hereditary mutations for cancer to occur. So, with our healthy lifestyle, we can decrease the epigenetic changes that can augment that hereditary mutation. So, again, I would like to stress that cancer is not a hereditary disease on a large. There are very rare cases where cancer can be hereditary, like breast and ovarian. Even in those cases, even in those cases, uh, his or her children, if they are harboring that mutation, can bring strict healthy lifestyle changes in their day-to-day life that can lead to dramatically decrease the chances of getting cancer in their later life. Thank you.